There was an awful lot of mixed messaging. I think you have to agree that there were contradictions, there was confusion with the messaging. And I've pulled up just a few things that Dr. Fauci said across time. He said we should not be walking with masks. Then he said, well, masks might make people feel better. And then cloth coverings are adequate. Then, of course, we know that's not true. You don't have to have double masks. Put a cloth mask over it. Then masks are protective. Walk outdoors without a mask, yes. Then you don't need a mask indoors if you're vaccinated. And then children outside don't have to wear a mask. If you're fully vaccinated, you do not need a mask. Then masks are not providing the perfect protection. Then children should be wearing masks. If vaccinated and indoors, wear a mask. Vaccinated fully, don't need a mask indoors. If vaccinated, you should wear a mask. And I'm looking, wait a minute, you say masks are protective, then you say, well, no, they're not. Fully vaccinated, you don't need a mask. Then vaccinated, you should wear a mask. You don't need a mask indoors if vaccinated, and then vaccinated indoors, wear a mask. I mean, it's A, then B, then A, then B, then A, then B. Why was that? I know that the learning curve was vertical, but I'm wondering why there wasn't more care taken in what was being said. And it was like it was a new message hour by hour instead of waiting to figure it out. What's your take on that?
Yeah, I think the messaging was obviously highly suboptimal. Very frustrating for me personally because I was a director of CDC, and I actually thought CDC should be directing the messaging, and that messaging should be the American public. It was very frustrating for me when the Secretary of Health basically limited and restricted CDC from communicating directly to the public. And you saw that Dr. Fauci became largely the spokesperson. My view is there was a great failure in the public messaging. There's no doubt about it. Some of it, of course, is learning curve, but I always think you just be honest with the American public. You tell them what you know and you tell them what you don't know. You don't try to act like you know something that you don't know. And again, I went back to the one point that I think our response would have been better served if we had a national response rather than 50 different states and then multiple territories having their own response. But the messaging was not, and even to this day, I think the messaging still concluded. When you use that term fully vaccinated, what does that mean? Well, you got two shots, but after 6 months, those shots don't provide you any protection. So why are we telling people they're fully vaccinated when in fact they're no longer protected by vaccine unless they get an additional shot? And even if they get a booster, that loses its efficacy for protection against Omicron 5 probably in 4 months, maybe 5 months. So I think the messaging has been very poor. It continues to be poor. Obviously, it's an opportunity for people like yourself to have honest discussions to try to help. But I won't defend the messaging. I think it confused the American public. Even when my predecessor and the person that came after me, Rochelle, she got up and she made a comment on national news with the CDC backdrop behind her. And I don't remember exactly what the subject matter was, but she was very definitive about what she wanted the American public to do. And then the very next day, the White House press secretary said she wasn't talking as the CDC director. She was talking on her own personal point of view, and that's not the government's policy.
Do you have a story or a question for me? Click the link in the description and tell me what in the world is going on.